Doreen 𝗏𝗏𝗂𝗏 is the
Dr. Doreen is an expert in autism.
Doreen 𝗏𝗏𝗂𝗏.
Dr. 𝗏𝗏𝗂𝗏.
Dr. Doreen 𝗏𝗏𝗂𝗏.
Dr. Doreen 𝗏𝗏𝗂𝗏 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Shanice has written in and said, how to manage separation anxiety. My son just started daycare 2 days ago and he's having major meltdowns. I want to know how Shanice is doing. Because the first 2 days that you send your child to any place is hard for you. And if they're not happy to skip away from you, it's that much harder.
So hard.
I want to know if you're like laying in your car with binoculars to see what's happening.
So hard. Oh my God.
Like many of us threaten to do, right? It's hard. That's a hard time.
It's very, very hard. It's very, very hard. And you know, it's not a bad thing, I'll be honest. Separation anxiety, I mean, the positive way to look at it is that he has a very strong bond with you. Mm-hmm. And so you have to ask the teachers to kind of meet with you and to do this very gradually. First of all, you unfortunately can't really be part of it. I think you have to have good teachers who are willing to engage and entertain and make your child feel safe. You know, you can, for instance, talk to them and see if they are willing to take some object of yours that will help the child know that, you know, you're coming back. Like, for instance, the whole thing with separation anxiety, by the way, is that our kids don't know when you're coming back. Yeah. And they are very much afraid of you never coming back, right? Yeah. So you can do it in pieces. Like, you can take the child, leave them for 15 minutes, and then come back, and then gradually make that 30 minutes, an hour, etc. This will take a long time. Mm-hmm. Or you can flood the child, which means you leave them for the first day, the second day. It takes a few days, but the individuals there have to be willing to console, you know, stay close, hold his hand, have contact, do fun things that are distracting. Mm-hmm. And they have to do that for a while until the fear has subsided, and now he's able to actually pay attention to some of the things that are going on around him, and then he will begin to enjoy. But I wouldn't, you know, and for you, Shannon, is so right. Like, one of the things that's very important, and these days we have so many cameras that can help with this type of thing. Like, for you, I would suggest that you actually, like, maybe get their permission and get like a Ring camera and put it inside there so you can actually see what is going on. You can see and hear what is going on all day long. Mm-hmm. And you just want to make sure that they are doing everything they can, because nobody should be ignoring a child who's having a meltdown due to separation anxiety. They should be engaging him, keeping him very busy, and so on. And sometimes at daycare, that doesn't happen because they're busy doing other things. Yeah. So if that is the case, and if he's just not getting the amount of support and attention, then I would take it slow. And I would do, you know, increase it by very short increments, so that your child gradually gets used to it.
I want everybody to hear what you just said, that no one should ignore a child who is going through a meltdown because of separation anxiety.
Absolutely,
I don't think people know that.
No, that's very, very important. Like, they should really be paying attention to this. This is not, you know, the function of this behavior is not to get them to, you know, get attention from them. It's fear. They're very, very much feeling afraid, and so they should be attended to.
But you know that there's a lot of people who think the extinction thing is
works
always
across
attention.
the board, yeah.
That it's always attention, and so you always ignore, and they think ignoring the child. It makes me insane.
Yeah.
Because you know why it makes me insane? Because it took me so long to learn what it really was. Yeah. And that it wasn't ignoring a child, it was ignoring a behavior. Right. Which is different than ignoring a child.
Absolutely.
And that you only ignored a behavior if the goal of the behavior was to get attention. Yeah. That took me 2 years, two solid years, because I was like, I don't get it. How come sometimes we ignore and sometimes we don't? But then when I got it, I was like, oh, everybody needs to get this, and so I'm impatient with people to get it. So we need to crochet that on a pillow. If a child is having a meltdown because of separation anxiety, do not ignore them. You give them more support. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.